This talk is about Brainstem auditory evoked potentials. It is intended for the Nicklaus Children's Hospital Clinical Neurophysiology Fellows. It will be conducted in a question and answer format. The first question is: brain auditory evoked potential equipment should be calibrated for click intensity and polarity. A, true, B, false. Only well-calibrated brain auditory evoked responses instruments should be used for testing. Intensity and polarity should be calibrated in all brain auditory evoked response machines. Most of the current machines have internal calibrating systems. These machines require little understanding of the process required to properly calibrate an instrument. Hence, I will only talk about the general principles related to calibration that I think will give you a leg up on the clinical use of the equipment. Intensity calibration consists on gauging the signal being delivered against a signal generated by the instrument based on the manufacturer's specifications, and making sure that both are the same. A sound signal in the form of a wave with the manufacturer's specifications is compared with the sound produced by a loudspeaker of the headphone, and if they do not match, the sound arising from the earphone is calibrated until the amplitude and morphology of the two waves are similar. In addition to intensity, polarity must also be checked. This used to be accomplished by examining the loudspeaker's diaphragm movement and its effect on the pressure it created on an artificial ear, which was measured by a pressure meter. While this was happening, we would be looking at the oscilloscope to determine the characteristics of the electrical pulse driving the loudspeaker. A loudspeaker, as you can see in this cartoon, has three components: a switch, a magnet, and a diaphragm. In this frame, you see that the switch is open. When the circuit is closed, depending on the direction of the current, up or down, the oscilloscope will register the current. In this case, I am representing the diaphragm going towards the magnet. So air is being pulled towards the magnet, creating a negative pressure which will be transmitted to the artificial ear. This is what is characteristic of rarefaction. Then, after 100 microseconds, the electrical pulse ends. And in the oscilloscope, we will see this by the rectangular wave going back to its baseline. As the circuit opens and the diaphragm returns to its original position, the pulse will terminate and the negative pressure will end, which will be reflected in the sound pressure meter. We can do the same with the direction of current being inverted, as suggested by the change in the order of the vertical aqua lines representing the battery. A positive pressure will so be created. This pressure will be sustained for about 100 microseconds, which will be reflected in the artificial ear. Meanwhile, at the oscilloscope, we will see the pulse, which is now in the opposite direction than it was before. The current pulse is reflecting condensation. After 100 microseconds, the pulse will stop, the circuit open, and the electrical pulse ends. The diaphragm of the loudspeaker will go back to its original position. So each electrical pulse have lasted 100 microseconds. So the answer to this question is true. Next question. Brain auditory evoked potential equipment should be calibrated every A. 6 months, B. 4 months, C. 12 months, D. 24 months. So click intensity should be calibrated every 6 months. And click polarity should also be calibrated every 6 months. Only when we have well-calibrated equipment will we get meaningful results. So the answer to this question is A. Next question. Routine brain auditory evoked potentials are generated in response to dash A. Clicks, B. Tone pips, C. chirps, D. all of the above. Brainstem auditory evoked potentials can be triggered by clicks. Clicks can contain many frequencies. Such clicks are classified as broadband or unfiltered clicks. The spectrum of most of these clicks, this one seen in this frame being an example, contains frequency from 100 Hz to 10,000 Hz. These frequencies stimulate the basilar membrane extensively, but not in a uniform fashion, because some areas of the basilar membrane will be receiving energy sooner than others, and also more intensely than others. The highest energy measured in decibel for this particular click is between 2000 and 4000 Hz. The maximal is precisely in this click at 3000 Hz. In addition to broadband unfiltered clicks, narrowband or filtered clicks can also be used. The spectral distribution of those clicks may vary. Here I have represented a click with a narrow band from 2000 to 5000 Hz. In addition to clicks brain auditory evoked responses can also be triggered by tone pip. This consists of stimulating using a pure tone. In this case, as you can see in this frame, I have represented a pure tone of 3000 Hertz. In addition to tone pips, brain auditory evoked responses can be triggered by chirps. Chirps consist of specific frequencies delivered at time intervals to oppose the time delay caused by cochlear anatomy. So at time 0, a low frequency narrow band click is delivered, followed by another similar click but with higher frequency delivered a little bit later, then a third one, and a fourth one. Notice that the time in the little clocks are different. The purpose for the sound to be given in this fashion is to stimulate further in the cochlea the first time, and with subsequent clips to do so closer to the base of the cochlea. In routine brain auditory responses, we use broadband clicks. Audiologists use tone pip for most part. So the answer to this question is A. Next question. A click with maximal spectral frequency at 3000 Hz will have a maximal impact on the basilar membrane 0.5 to 1 second after the cochlear stimulation. A true, B false. This figure shows different elements corresponding to a click. An electrical pulse lasting 100 microseconds, an acoustic wave which is produced by the electrical pulse, and below the spectral frequency of the sound it generates. This figurine I have just added depicts a basilar membrane. In it, I am representing at one end the basal turn and on the opposite end the apical turn. Now I have added the frequencies corresponding to their place of detection in the basilar membrane of the cochlea. Notice that high frequencies are at the base and low frequencies are at the apex. Now I have added the distance of the basilar membrane from its base to the apex. As you can see, it is 35 millimeters. And now the time it takes for a sound wave to reach the different segments of the basilar membrane, which as you can see can go from 0.1 millisecond to 5 milliseconds. Now I am adding a cartoonish representation of a click with maximal energy at 3 kilohertz. Notice that the click has two words represented, passive and active. This is to convey the idea that at the time of maximal energy, hair cells become active. In such area, the outer hair cells register sounds and the inner hair cells amplify the movement of the tentorial membrane, that is, of the basilar membrane. So the answer to this question is true. Next question. Brain auditory evoked potentials only survey the central nervous system structures. A, true. B, false. Sound translates into pressure that at the level of the cochlea translate into electricity, triggering an action potential that travels through the nerve, that is, through the auditory nerve, then goes into the brainstem and reaches all the way in the brainstem to the inferior colliculi. Some believe that this ascension through the brainstem is synchronized and rather symmetrical. Others consider that more fibers ascend in the contralateral side to where the stimuli came in, while others believe that there are two pathways, one dorsally and another pathway ventrally. They call the dorsal one the dorsal auditory stream and the ventral one the ventral auditory stream. From the inferior colliculi, electricity travels to the cortex, some say symmetrically, where others believe that it does so a little bit in an asymmetrical fashion, more so on the contralateral side to the stimuli arrival until it reaches the cortex, where acoustic information is processed. So the answer to this question is false. Next question. Brain auditory evoked potentials components generated within the brainstem are mediated by the dorsal auditory stream. A, true. B, false. Those that adhere to the stream arrangement believe that the dorsal auditory stream originates from the dorsal cochlear nucleus. They also believe that speech discrimination travels rather exclusively in it, and that the ventral stream, starting in the ventral cochlear nucleus, carries sound localization, and that this stream is the origin of the waves recorded by the brain auditory evoked potential. So the answer to this question is false. Next question. Brain auditory evoked potentials occurs precisely between dash milliseconds. A, 0 to 20, B, 1.3 to 10, C, 3 to 10, D, 10 to 20. Evoked potentials are often classified according to their onset and duration. So we talk about short latency auditory evoked responses when they occur between 0.1 and 10 milliseconds. We talk about middle latency auditory evoked responses when they occur between 10.1 and 50 milliseconds. And we talk about long latency auditory evoked potentials when they occur after 50 milliseconds. Short latency potentials are further divided into electrocochleography, which traces the wave occurring between 0.1 and 3 milliseconds. These waves are created by the reaction of air cells in the organ of Corti and the action potential volley most distal to the region of the cranial nerve 8. And a second type of potential that is brain auditory evoked potentials. These potentials capture waves generated between 1.3 to 10 milliseconds. These waves, as you know, are generated in the auditory nerve and the brainstem. So the answer to this question is B. Next question. Sweep time for brain auditory evoked responses should be dash milliseconds. A 15, B 5, C 7, D 8. During brainstem auditory responses, we are looking at short latency potentials. Cranial nerve 8 and brainstem potentials occur in the first 10 seconds after stimulation. But to be on the safe side, especially in cases that we suspect pathology, it is best to record a little bit longer. So most recommend that the recording time or the sweep time for each stimulus be from 10 to 15 milliseconds. Certainly in children, we must record for 15 milliseconds. And in cases where we suspect pathology, as we previously mentioned, also we must record for 15 milliseconds. Another situation where prolonged recording is advisable is during surgical procedures. So the answer to this question is A. Next question. A condensation click causes the stereocilia in the hair cells to initially move in a depolarizing direction, whereas rarefaction causes the stereocilia to move in a hyperpolarizing direction. A true, B false. As you know, changes in clip polarity can produce rarefaction or condensation. At the level of an ear, a loudspeaker set for rarefaction upon activation will suck the air into the loudspeaker, displacing the tympanic membrane towards the loudspeaker. So at the level of the organ of Corti, the hair cells will move in such a way that depolarization will be triggered. Condensation has the opposite effect. Pressure on the tympanic membrane generated by the microphone causes the tympanic membrane to move towards the middle ear, and the hair cells to move in the direction of producing hyperpolarization. So of the three possible click polarities that we can use, rarefaction is usually preferred for routine testing because of its ability to produce depolarization at the level of the hair cells. But in the operating room, alternating polarities are preferred because the combination decreases artifacts. So the answer to this question is false. Next question. A single monophasic square wave of 100 microsecond rectangular pulse produces an acoustic wave of the same duration. A true, B false. An electrical monophasic square wave lasting 100 microseconds triggered, as in this case by rarefaction, produces a rather complicated acoustic wave. The first and largest component of the acoustic wave lasts longer than the stimulus. And in addition, subsequent smaller wave will be produced that can last up to more than 1 millisecond. Condensation clicks are much the same, but in the opposite direction. And alternating polarities, that is using clicks with alternating polarity, causes an even more complex acoustic wave. So the answer to this question is false. Next question. Which of the following clicks parameter is not right for routine brain auditory evoked responses? A. Duration 100 microseconds. B. Intensity infants 70 dB SL. C. Rate 11 Hz. D. White noise 30 dB below stimulation level. The duration of a click can vary, but the usual duration is about 100 microseconds, as you can see depicted in this frame. The stimulus is given to a single ear, that is mono-aural stimulation. The stimulus intensity can be given in decibel peak equivalent sound pressure level, as it is recommended by the Academy, or in decibel sound pressure level. If you do not understand these units, go to the video titled Sounds for Neurophysiologists in this channel and hear it and see it. Maybe that way you will understand it. Regardless of the unit used, click starting points can be the patient's own hearing, in which case we use the term above sensory level or SL. This method obviously cannot be used for children or uncooperative patients because it depends on their cooperation. Another way of measuring the stimulus is by establishing normals in our own lab and then determining how much more we have to add. And basically, when I refer to establishing normals in our own lab, I'm referring to the softest sound heard by a significant number of patients within an age range in order to determine an appropriate control. When we do so, we talk about normal hearing level, or NHL. When designating a click as SL and using peak dB peak equivalent SPL as a unit of intensity, we usually arrive to the desired click intensity by adding 100 dB peak equivalent SPL to the sensory level of the particular ear. When designating a click as SL but using dB SPL as unit, the intensity of the click is usually arrived by adding 70 dB SPL to the sensory level of the particular ear. When designating a click as NHL and using dB peak equivalent SPL level as the unit, the intensity of the click is usually that of 100 dB above the peak equivalent SPL intensity of the normal control lab. When designating the click as NHL but using dB SPL as the unit, the intensity of the click is usually arrived by adding 70 dB SPL to the intensity established as normal. But the range of the amount that has to be added is very variable, and judgment as well as trial and error has to be used in order to find the appropriate click intensity. In general, when using dB peak equivalent SPL instead of dB SPL, we need to use about 30 dB more. That is, we have to add about 30 dB when we use peak equivalent level to the intensity that we would add if we were using dB SPL. Another important thing is that most machines are set to deliver the sum of both, and that increasing the dB shortens latencies. It is important and elementary to remember that in addition to the stimulus being used in the ear being studied, it is important to use masking sound in the opposite ear. The masking sound consists of a broadband, very broadband noise applied to the opposite ear that we tend to call white noise. The Academy guidelines recommend to use 60 dB peak equivalent SPL as a masking noise. Others believe that the amount or the intensity of the noise in the masking ear should be 40 dB less than is being used in the ear that is being stimulated. The click rate may vary from 5 to 200 Hz. Most often rate used range from 8 to 10 Hz, and that is what the Academy recommends. Levin and Luthers recommend using 11 Hz and to stay away from multiples of 60 in order to avoid artifact. That seems to me to be a very sound advice. So the answer to this question is B. Next question. Where should an electrode be placed for regular brain auditory evoked responses? A, CC, B PC, C FPC, D O1. The location of electrodes for brain auditory evoked responses is rather well standardized. An electrode is placed at CZ, another at FC, another on the ear or mastoid being tested, which is labeled AI. The I stands for ipsilateral, and another electrode on the opposite side. That electrode is labeled AC, for the C stands for contralateral. The stimulus is given on the ear labeled ipsilateral, and the masking noise is obviously given in the other ear. FC is used as ground. Impedance should be kept below 5 kilo ohms. Some recommend to be kept even lower, to less than 3 kilo ohms. So the answer to this question is A. Next question. Which of the following derivations should not be used for routine brain auditory evoked potential? A. ZZ to A1 or AI. B. ZC to AC. D. FC to ZZ. D. M1 to ZZ. Brain auditory evoked responses are usually recorded using two channels. One channel from ZZ to ipsilateral ear or mastoid, and the other channel from ZZ to the contralateral ear or mastoid. The positivity at CC is always up. Very often, the order of the electrodes is inverted in many presentations. Yet the convention that CC is positive is maintained. Before leaving the subject of montage, I'd like to mention that there is a third type of montage that compares contralateral ear with ipsilateral ear. This arrangement referring contralateral ear to ipsilateral ear is important because it maintains positivity up rule. So the answer to this question is C. Next question. What filter setting should be used for brain auditory evoked responses? A. Low frequency filter 10, high frequency filter 3000 Hz. B. Low frequency filter 1, high frequency filter 70 Hz. C. Low frequency filter 200, high frequency filter 3000 Hz. D. None of the above. The horizontal line in this frame represents volts. The vertical line, frequency in hertz. The desired activity to be captured during brain auditory evoked responses study is from 10 Hz to 3 kHz. This is represented in this frame. Though most commonly the low frequency filter is set at 10, as I just previously mentioned, at times we may have to increase the low frequency filter if EMG or mechanical artifacts are present. In children in general, it is recommended to be close to 10 Hz and not to go more than 30 Hz at any time. Fast frequency filter should be used at 2500 to 3000 Hz. High frequency filter in the OR may require being brought down some. Roll-off recommendations by American Clinical Neurophysiology Society are not to exceed 24 dB per octave for high frequency filter or 12 dB for low frequency filter. So the answer to this question is A. Next question. If a response has an amplitude of 10 microvolts and the surrounding noise is 100 microvolts, it would take dash responses to improve the ratio to 1. A 100, B 1000, C 2500, D 10,000. The signal to noise ratio is obtained by dividing the amplitude of the response we want to study by the amplitude of the noise. So in this case, 10 microvolt is divided by 100 microvolts. So the sound to noise ratio is 0.1. Sound noise ratio improved by a factor equaling the square root of the number of responses averaged. So the easiest way is to fix the equation in this frame, as in this frame. It is good to think that signal improvement is equal to the sound noise ratio multiplied by the number producing the desired signal and then having that number squared. Take a few seconds to look at this frame to make sure that this concept is relatively clear. So in this question, that we want to improve the ratio of 0.1 to a ratio of 1, which I have now represented in this frame. Then executing this operation step by step, you see that 10 is equal to x. Thus, the signal has to be a square, therefore 10 square. So in this case, to bring the ratio to 1, we will have to give 100 trials. In reality, when we do a brain auditory evoked potential, we need much more trials than 100. The number is 1000 to 4000. So remember that the number of trials that we usually need to get in order to get a fairly clear brain auditory evoked response is from 1000 to 4000 trials. So the answer to this question is A. Next question. The time horizon resolution of the display system should be dash microseconds per data points or less. A 20, B 200, C 150, D 225. Guidelines recommendation state that each horizontal point must not be further apart than 20 microseconds. Levin and Luters in their book recommend that they should be no further apart than 100 microseconds. So the answer to this question is A. Next question. What are the usual amplitudes setting for brain auditory evoked responses? A. 0 to 20 microvolts, B. 0 to 10 millivolts, C. 0 to 0.6 millivolts, D. 0 to 0.6 microvolts. In this frame, I have represented an ear that is the outer, middle, and inner ear. I've done so to show that a compound action potential will measure differently according to where it is measured. So when it is measured in the promontory, it will have an amplitude of 15 microvolts. If it is measured from the tympanic membrane, it will have an amplitude of 3 microvolts. If it is measured from the external ear canal, it will have an amplitude of 1.5 microvolts. If it is measured at the earlobe, it will be 0.5 microvolts. In this new frame, I have used the same figure that I used in the past to represent filters. As you can see, the amplitude for brain auditory evoked responses collected from the ear is a low amplitude enterprise. In most patients, brain auditory evoked responses are less than 1 millivolts, more in the range of 0.6 microvolts. For this example, I have used the very short duration of recording to show things better, but remember that it is best always to collect information for about 10 to 15 milliseconds after the stimulus. In this new frame, I have added two relatively small lines indicating microvolts. As you can see, I have added the polarity to be plus on the upside. In this frame, you can see the montage that I will use very often for the rest of this presentation. Remember that the ground not presented here is located at Fc. So the answer to this question is D. Next question. Which of the following is not true regarding wave 1? A. Created by the action potential of neurons in the spiral ganglion of the cochlea and possibly by traveling volley through the interosseous portion of cranial nerve 8. B is a negative near field. C is generated close to the apex of the cochlea. D, its presence preclude the diagnosis of brain death. The framework that I will use to describe future brain auditory evoked responses is presented here. The bottom segment has the ipsilateral derivation. Ipsilateral implies that it's the ear that is being stimulated. The top segment has the contralateral derivation. In both derivations, ZZ is positive. Now I have removed the designations, but we should understand that the arrangement continues for the future frames. I have now introduced the figure of the auditory system that I have shown you before. Wave 1 is due to the action potential that starting in the spiral ganglion cells travel through the interosseous segment of cranial nerve 8. The wave is present in the ipsilateral side, but never before 1.2 milliseconds after the stimulus. No wave 1 is present in the contralateral side. The yellow arrows I have introduced now are there to depict their site of origin. At the level of the cochlea, using an electrical pulse of 100 microseconds that will produce a click with a frequency with a maximal energy at 3000 Hz, which I have here represented as a pink triangle, wave 1 will be generated by frequencies in the 8 to 4 kHz close to the base of the basal membrane with minimal cochlear delay and with a latency of about 2 milliseconds in adults. At this junction, I am reintroducing the figure with the waves to show you the field that generates wave 1, which is a near field with a negative potential at the level of the ipsilateral ear, and also a widely diffuse positive field that expands throughout the head. So the answer to this question is D. Next question. Which of the following is not true regarding wave 2? A. Generated by intracranial cranial 8 traveling volley and the ipsilateral cochlear nucleus. B. The field created is positive at CC, skewed towards the ipsilateral ear. C. Is smaller and slender on the contralateral side. D. Its presence precludes the diagnosis of brain death. Wave 2 is generated by different structures, ipsilaterally and contralaterally. Ipsilateral wave 2 is generated by the intracranial portion of cranial nerve 8, the ipsilateral cochlear nuclei, and by fibers traveling to the trapezoid body. The contralateral wave 2 is probably the result of the electrical volley traveling through the trapezoid body, as well as the field produced by the nuclei of the trapezoid body. The absence of contribution from cranial nerve 8 to the contralateral wave 2 makes that wave a bit smaller and more slender than the wave arising from the ipsilateral channels. It appears to be that the field that creates this wave ipsilaterally and contralaterally is primarily maximal at CC and leaning to the ipsilateral ear. An interesting fact is that in brain death, prior to compression of the cochlear artery, ipsilateral wave 1 and a reduced component of wave 2 are usually present. That is so because the component of the wave 2 that is ipsilaterally present is that of the cranial nerve 8 before it reaches the brainstem. It's interesting that those waves disappear once the cochlear artery is compressed. So the answer to this question is D. Next question. Which of the following is not true regarding wave 3? A. Generated mainly by the superior olivary nucleus. B. The field created is positive at CC skew to the contralateral ear. C. Is smaller on the contralateral side. D. Its absence is abnormal. Wave 3 is mainly generated by the superior olivary complex. perhaps with some contribution from the medial nucleus of the trapezoid and pontine lemniscus. It is a mixed potential being generated by a mixture of traveling, junctional, and gray matter or stationary potentials. The contralateral wave 3 tends to be smaller than the ipsilateral one, but it peaks slightly earlier. The absence of wave 3 in the presence of normal wave 5 is not abnormal. It is considered a normal variant. The field generating wave 3 is maximal at ZC with a tilt towards the contralateral ear. So the answer to this question is D. Next question. Which of the following is not true regarding wave 4? A. It is generated above the inferior colliculi. B. Its maximal field is at ZC extending to the contralateral ear. C. It usually forms a wave 4 and 5 complex. D. It is tallest in the ipsilateral ear. The origin of wave 4 is certainly in the upper pons, most likely from the rostral lateral lemniscus, and perhaps some components do arise from the inferior colliculi. It is generated from the traveling potential generated by the electrical activity as it is conducted through the lateral lemniscus. So it has to do with the junctional potential as the lateral lemniscus changes direction or the medium changes, or from great matter nucleus or nuclei that are scattered in the lateral lemniscus pathway. The field creating wave 4 is maximal at CZ with extension to the contralateral ear. So the answer to this question is A. Which of the following is not true regarding wave 5? A. It is generated at the inferior colliculi. B. The maximal field is at ZC extending to the ipsilateral ear. C. It is usually mixed with wave 4 and 5, creating a complex. D. It is tallest in the ipsilateral derivation. Wave 5 originate most likely from the inferior colliculi, perhaps with some contribution from the lateral lemniscus. It is believed to be due to gray matter potentials and white matter junction potentials created at that level. I have introduced this figure before, initially when I talked about wave 1, to give you a few more facts about wave 5 in this case. So as you can see, wave 5 is triggered by sounds having a frequency of 1 to 4 kilohertz. It stimulates the cochlea at about 15 to 25 millimeters from its base. Therefore, it has a cochlear delay of around half millisecond and has a latency of about 5 seconds when it comes to the brain auditory evoked response. The field creating wave 5 is maximal at ZC, extending towards the ipsilateral ear. The fact that the positive field extends towards the ipsilateral side makes wave 4 from the contralateral derivation be taller. The interrelation between the peak of wave 4 and 5 is very variable. Even when using the same derivation and the same ear. Wave 5 may be smaller than wave 4 or as tall as wave 4. Wave 5 may be clearly separated from wave 4 or completely fused with wave 4. Wave 5 may present in the descending arm of wave 4 or at the peak of wave 4. In other cases, wave 4 may just be a small hump on the ascending arm of wave 5. One almost constant finding that in relation to wave 5 is that the descending arm of wave 5 drops below the baseline of the complex. So the answer to this question is D. Next question. Which of the following is true regarding wave 6? A. It is generated by a volley traveling in the brachium of the inferior colliculi. B. It is positive at CC. C. It is not reliable for clinical purposes. D. All of the above. Wave 6 is generated by the brachium of the inferior colliculi. It is positive at CC, and as probably you know, this wave is not used clinically because it's very variable. So the answer to this question is D. Next question. Which of the following is not true regarding wave 7? A. It is generated by the volley traveling in the auditory radiations. B. It is generated by the lateral geniculate ganglion. C. It is not reliable for clinical purposes. D. It occurs within the first 5 milliseconds after stimulation in adults. Wave 7 is generated probably from the medial geniculate ganglion and the auditory radiations, although its origin is very much in question. Wave 7 is not reliable for clinical purposes, and it does not occur within the first 5 milliseconds of a stimulation. So the answer to this question is D. Next question. Which of the following waves will change the most from changing the exploring electrode position without changing the reference electrode position? A. Wave 1. B. Wave 3. C. Wave 5. D. Wave 2. Significant uncertainty exists as to the type of field producing the different waves that encompass the brainstem auditory evoked potential. Most papers I have read on the subject concur that wave 1 is brought about as a negative field restricted to the site of the stimulation, and perhaps a positive field diffusely affecting the whole head. Wave 2, wave 3, 4, and 5 are said primarily to result from far fields, yet they do not conform to all the criteria required to define them as far field. Only wave 1 greatly changes with minimal changes in position of the exploring electrodes. Another thing that is important to remember about the nature of these waves, or the appearance of this wave, is the fact that although all the fields in wave 2, 3, 4, and 5 are maximal in the C3 area, some of them tend to be more prominent towards the ipsilateral ear and some of them tend to be more prominent towards the contralateral ear. Wave 2 and wave 5 tend to be more prominent towards the ipsilateral ear, whereas wave 3 and 4 tend to be more prominent over the contralateral ear. So the answer to this question is A. Next question. Brain auditory evoked responses waves, latency, amplitude, and morphology are influenced by A. Gender, B. Age, C. Temperature, D. All of the above. Latency, amplitude, morphology are influenced by age, gender, temperature, and also by the click. So the answer to this question is D. Next question. Which of the following statements regarding age and brain auditory evoked response is not true? A. Bifid wave 1 is common in neonates. B. Wave 1 reaches maturity before wave 5. C. Lab's normal control should be collected at 2 weeks interval between 30 and 40 week conceptual age. D. With all age, 1 to 3 interval increases less than 3 to 5 interval. Age affects latency. The studies in neonates were done using clicks with an intensity of 60 dB hearing level, using conceptual age, going from the time of birth all the way down from 30 weeks conceptual age to 44 weeks conceptual age. Since the time of birth do not interfere with brainstem auditory system maturation, this constellation of wave is a representation of the wave obtained at different conceptual ages, as I previously stated. Wave 1 has a latency decrease at a steady pace. Wave 5 has a more curvilinear pattern of maturation because the central nervous system matures at a much slower pace than the peripheral nervous system. Thus, the more immature central conduction leads to more delay latency for wave 5 than it does for wave 1. And it also leads to narrowing of the interval between 1 and 5 from the 36 to the 40 weeks conceptual age. It is important, or at least it is important for the exam to know that from 25 to 30 weeks, half of the time, brain auditory evoked responses cannot be elicited. And not eliciting them should not be considered an abnormality. Often, these patients have cortical potential despite the absence of brainstem potential during this age. The interpeak 1 to 5 interval, as we previously mentioned, drops 2 to 3 milliseconds from week 25 to week 40. Yet from 32 to 34 weeks, it dropped much faster than at any other time during this period. The 1 to 5 interval reaches adult value by a year and a half. Latency to wave 1 reaches adult value by about 6 weeks. Thus, for neonatal brain auditory evoked responses, control should be established for each 2 weeks from 25 to 40 weeks, and at 3, 6, 12, and 52 weeks after term. In this frame, you can see the upper limits of normal that I think work for most children. That is, going from children to adult. But it must be stressed that every lab should develop their own controls. At term, the upper limits to wave 1 is 2.93 milliseconds. And the 1 to 5 interpeak latency should be less than 6.34. At 3 weeks, the upper limits to wave 1, that is the latency to wave 1, should be less than 2.52 milliseconds. The 1 to 5 interval should be less than 6.21 milliseconds. At 6 weeks, the latency to 1 should be 2.4 milliseconds or less. And the interpeak latency from 1 to 5 should be less than 5.8 milliseconds. At 4 months, the latency to 1 should be less than 2.3 milliseconds. And the 1 to 5 interpeak interval should be less than 5.6 milliseconds. At 6 months, the latency to wave 1 should be 2.3 milliseconds or less. And the interpeak latency from 1 to 5 should be 5.5 milliseconds or less. At 1 year, the latency to 1 should be 2.3 milliseconds or less. And the interpeak latency should be 4.9 milliseconds or less. At 2 years, the latency to 1 should be 2.3 milliseconds or less. And the interpeak latency, it should be 4.6 milliseconds or less. In adults, the upper limit of normal latency to 1 is 2.4 milliseconds. And the 1 to 5 interpeak interval should be less than 4.6 milliseconds. Notice that the latency to 1 after 4 months does not change, since it is solely dependent on peripheral nervous system maturation. Whereas the 1 to 5 interpeak interval only stops changing after 2 years. This is so because it is then that the central nervous system at the level of the brainstem reach maturity. So changes to latency of wave 1 are only present in the first 4 months of life. Interpeak 1 to 5 interval changes occur until 2 years of age. No change occurs during adulthood until old age. During old age, all waves become prolonged, but according to some, especially the interval between wave 1 and 3 becomes prolonged. Age also influences amplitude. This figure is the same figure I was showing you regarding conceptual age before. As you remember, time of birth does not affect maturation of the central nervous system or the peripheral nervous system. This, as you recall, are the presentation of the wave obtained during different conceptual ages. The amplitude of wave 1 increases during preterm life, and so does the amplitude of wave 5. Yet, after 1 month of life, the amplitude of all waves begins to drop. age also affects morphology. At 30 weeks of conceptual age, half of the time wave 1 is not present despite good hearing judged by behavior. By 40 weeks, wave 1 is often biphasic, and it is often followed by a prominent deflection. By 3 months, wave 1 is usually monophasic, having a single peak. And by month 6, wave 1 has a prominent deflection. So the answer to this question is D. Next question. The difference of brain auditory evoked responses related to gender are present at birth. A true, B false. Gender also affects latency, amplitude, and morphology of the brain auditory evoked responses waves. Males and females do not show any difference in brain auditory evoked responses wave before 8 years of age. After 8 years of age, latency to wave 1 is minimally decreased in females. Latency to wave 5 is about 1.5 to 2 millisecond decreased in females. And the interval between 1 and 5 is also significantly decreased. It is interesting that this decrease seems to be maximal during menstruation. The amplitude of all waves are 50% higher in women than in men. The difference has led some authors to have different sets of normal, those using an interval of 2.4 milliseconds as the upper limits of normal for 1 to 3 interval and 2.2 milliseconds for the interval between 3 and 5. So the answer to this question is false. Next question. Which of the following statements regarding temperature and brain auditory evoked responses is not true? A. As temperature drops, latency to wave 1, 3, and 5 increases. B. 1 to 5 interpeak intervals increases with temperature drop. C. Amplitude rises with hypothermia until 28 degrees or 27 degrees centigrades. D. Brain auditory evoked responses wave are absent after 23 centigrade or less. Temperature has a significant effect on latency, amplitude, and morphology of the brainstem auditory evoked responses wave. The changes in morphology result from the changes in latency and amplitude. Latencies to all the wave found in brainstem auditory evoked potentials, that is to wave 1, wave 3, and wave 5, increase as the temperature drops. This increase appears to be more severe in later components than in earlier components. So, latency to 3 is more delay than latency to 1, and latency to 5 is more increase than latency to 3. It has been estimated that for each 1 degree Celsius drop in temperature, latency increases by about 7%. The 1 to 5 interval indicated by the arrow increases as the temperature drops, as you can see by comparing the upper and lower arrow. Amplitude is also affected. The amplitude of the waves increases up to temperature going down to 27 Celsius degree. After, that is when the temperature keeps on dropping, then the amplitude of the wave starts decreasing. And usually by 20 degrees Celsius, all waves are absent. Rewarming produces the same changes but in the opposite direction. As the temperature goes from 21 to 28, the amplitude increases. After about 28 degrees centigrade, that is from 28 to 36 degrees centigrade, the amplitude decreases. The changes in latency can be summarized as a correction from those present during the production of hypothermia. So the answer to this question is D. Next question. Break auditory evoked responses, latency, amplitude, and morphology are influenced by the clicks: A. Frequency, B. Intensity, C. Polarity, D. All of the above. The most important factor influencing latency, amplitude, and morphology of a wave is a click. That is at least the one that we have more control of. The click has several parameters that influence latency, amplitude, and morphology of a wave. These parameters are frequency, duration, intensity, polarity, and rate. So the answer to this question is D. Next question. Which of the following stimulus factors is less subject to change when performing a regular brain auditory evoked response? A. Frequency, B. Intensity, C. Polarity, D. Rate. Regular brain auditory evoked response conducted by neurologists are performed using broadband clicks. These clicks have a frequency spectrum given by the manufacturer of the equipment and are not subject to change. Frequency, on the other hand, is very important and subject to manipulation for audiological testing. The stimuli used for audiological testing is called tone pips. They use a restricted frequency. Using a tone pip with a frequency of 500 Hz, the apical region of the basilar membrane will be stimulated. Such a stimulus will produce no wave except for wave 5, which will be delayed. Using a pure tone of 2000 Hz, all the waves can be clearly appreciated, and there is a significant decrease in the latency of wave 5. Using 10,000 pure tones, all waves are appreciated, and wave 5 is significantly increasing amplitude. Remember that wave 1 is primarily triggered by a stimulation of the basal membrane between 1 and 4 kHz, whereas wave 5 is best brought about by stimulating the basilar membrane in the 4 to 10 kHz region. So the answer to this question is A. Next question. Most frequent stimulus duration used in regular auditory evoked potential is dash microseconds. A 50, B 100, C 200, D 25. Of the click elements that influence waveform, duration is probably the least mentioned variable of all. Most studies are performed using a square electrical wave pulse of 100 microseconds. The frequency spectrum of a 100 microsecond click is presented in this page. Basilar involvement, represented by the pink triangle, indicates that the maximal activity of most click commonly used is in the 3000 range. The frequency spectral of a 200 microsecond click is slightly different, as you can see in this frame. And so is the profile of the basilar lamina involved by a 200 microsecond pulse. Here I have superimposed the profile of a 100 microsecond click on a 200 microsecond click. As you can see, there is not much difference, yet at times in the OR, increasing the duration of the electrical pulse is enough to improve resolution. In the classical experiment by Jewett and Willingston, only 50 microseconds were used. So the answer to this question is B. Next question. Which of the following statements about a stimulus intensity is not true? A. All peaks latencies decrease 0.03 millisecond per dB with increased click intensity. B. The last wave to disappear as the click intensity is decreased is wave 5. C. Wave 5 latency decreases linearly as intensity is increased. D. 1 to 5 interval increases with higher intensity. Of the click elements that influence waveform, intensity is one of the most manipulated ones. This figure shows a cartoonish representation of brainstem auditory evoked responses with only one variable, intensity. Now I have traced wave 1 from using a stimuli of 110 SPL hearing level to 50 SPL hearing level. As you can see, the latency at 110 SP hearing level, that means 110 dB, is 1.4, where when we use an intensity of 50 dB, the latency to wave 1 goes to 3.1. So as indicated, the latency to wave 1 at 50 dB is increased in relation to the latency of wave 1 at 110 dBs. I have now traced wave 5. Notice that at 20 dB, when no other wave is present, that is, there is no wave 1 or 3, wave 5 is present amidst with a very long latency. Also notice that at 110 dB, the latency to wave 1 has almost halved. As a general rule, latency to wave 5 decreases at a rate of 0.03 milliseconds per dB as the intensity is increased. It is also interesting that the 1 to 5 interpeak interval is shorter at 50 dB than at 110 dBs. So, important point to remember are that wave 5 is the last one to disappear as we decrease intensity. Wave 5 may persist even at 10 dB above hearing level. The latency to wave 5 changes most from 40 to 60 dB above hearing level. And that the 1 to 5 interval increases as the intensity of the sound increases. So the answer to this question is C. Next question. Latency to all waves decreases and amplitude increases as intensity is increased because A. At high intensity levels, the latency of the brain auditory evoked responses to click is dominated by activity initiated at the basal end of the cochlea. B. At low intensity level, the latency to brain auditory evoked responses to click is dominated by activity initiated at the apical end of the cochlea. C. Increased stimulus intensity increases the rate of neuronal firing, which leads to increased recruitment and improved synchronization. D. All of the above. Intensity influences latency and amplitude by modifying recruitment and synchronization. Increasing sound intensity leads to increased firing rate of cochlear neurons and a stimulation of the basal region of the basilar membrane. So the answer to this question is D. Next question. Which of the following statements about a stimulus polarity is not true? A. Latency to wave 1 is shorter and amplitude higher with rarefaction. B. Wave 4 is more prominent and apart from wave 5 with rarefaction. C. 4 to 5 interval is increased by condensation. D. Summation of rarefaction and condensation averages eliminates stimulus artifact and microphonics. The fourth factor that influences wave characteristics is polarity. As you remember, depending on the electrical pulse used to trigger an acoustic wave, a stimulus is called rarefaction or condensation. When these two methods are combined during the collection phase, the term used is alternating polarity. In this frame, I have superimposed the wave produced by both modalities gathered individually. The most important differences are that latency to wave 1 is shorter when gathered by rarefaction. The amplitude of wave 1 is increased by rarefaction. The latency to 4 is shortened by rarefaction. The amplitude of 4 is increased in relation to wave 5 by rarefaction. The latency to 5 does not change with either rarefaction or condensation. Hence, the 4 to 5 interpeak increases with rarefaction. It is important to notice that wave 1 and wave 5 go in the same direction and do so more or less at the same time, and that the stimulus artifact go in opposite direction simultaneously. Alternating rarefaction and condensation produces a tracing with no stimulus artifact. So the answer to this question is C. Next question. Which of the following statements about the stimulus rate is not true? A. Latency to wave 5 increases if rate increases. B. Latency to wave 1 increases if rate increases, but by less than wave 5. C. Drop in amplitude with increased rate is more prominent in wave 5 than in wave 1. D. The effect of decreased amplitude and increased latency are likely due to the forward masking effect. The fifth factor that influences wave characteristics is rate. In this frame, all stimulating factors have remained fixed except the rate of the stimulus being delivered. At 10 stimulations per second, all waves look more prominent and latencies are shorter, especially the latency to wave 5, than at 80 stimulations per second. The drop in amplitude is more prominent in wave 1 than in wave 5. The explanation for these changes is that latency increases the forward masking effect. The forward masking effect consists of the blurring effect of the prior click to the following click. So this effect will increase when the frequency of a stimulation, that is the rate of a stimulation, is increased. So the answer to this question is C. Next question. Using AC to AI derivation increases the amplitude of wave 1. A true, B false. In this frame, you can see the electrical fields that are produced as electrical activity travels in the auditory system, and you can also see the configurations of the fields that they produce. Notice that the AC-CC derivation shows no wave 1. In this new frame, the top derivation has been changed. It now consists of AC to AI. Notice that wave 1 is very prominent. This is so because the negativity at AI is now compared with the positivity at AC, which, unlike CC, is not contaminated by the negative field that is produced at the ipsilateral ear with the stimulation. So the answer to this question is A, true. This is the last question. What is it? A, stimulus artifact. B, wave 1. C, summating potential. D, none of the above. As you can see, now that we have done an electrococlogram, the meaning of the previous wave becomes very obvious. We are dealing with summating potential. The reason that I show you this frame is to point out that occasionally, when in doubt, if you use an electrode from the ear being stimulated to the external auditory meatus, or just if you put it inside the ear canal, you will be able to get a very clear distinction between summating potentials in N1, which corresponds to wave 1 in the brain auditory evoked response. That is in the brainstem auditory evoked responses. So the answer to this question is C. Thank you very much for your attention.